Hello, thank you for considering Trinity In-Home Care for your in-home support services. This video is intended to give you a little background on Trinity In-Home Care, share with you a little what you can expect as a client of Trinity In-Home Care, and offer you some guidance of what you can do to ensure a successful support service experience. As you may know, Trinity In-Home Care was founded in the mid-60s by a group of people who attended Trinity Episcopal Church here in Lawrence. At the time, these grassroots volunteers focused on providing supports to families and foster families of children with developmental disabilities. In 1976, Trinity In-Home Care became a standalone, private, nonprofit social service agency, no longer affiliated with the church. We are governed by a volunteer board of directors and are a committed part of the Douglas County service community. We continue to provide services to children with disabilities until the early 1980s, and at that time, Trinity In-Home Care began to also provide services to adults with physical disabilities and adults who want to remain in their home or delay or prevent living in a nursing facility. We continue with that core mission today. Our clients are as young as 5 years old through the end of adult life throughout Douglas County. Because our clients are so diverse, we partner with other support service agencies throughout the community to offer services that are personalized, affordable, and flexible. Trinity In-Home Care employs compassionate, dedicated individuals as caregivers, also called direct support professionals, to fulfill these services. So, what are support services? These are tasks that an individual may need assistance with in their home or in the community, which are non-medical in nature and help that person live independently in the home of their choice. Examples of these services that Trinity In-Home Care's direct support professionals can provide include help keeping the home clean and safe, often called light housekeeping, help with taking a bath or a shower, or other activities that care for the cleanliness of a person's physical body, making meals and cleaning up afterward, running errands and going to appointments, either driving the client's vehicle or providing transportation in the direct support professional's personal vehicle. In this case, there is a gas reimbursement responsibility for the client. Providing supervision in the community for those who are unable to participate in community activities on their own. Provide supervision, sometimes known as respite care, in the home for those who cannot be left alone for their safety. This allows the client's family members to attend to their own appointments, work, or personal needs. Checking medication boxes to be sure that meds are taken and taken correctly, and then notifying family or a case manager if it appears that medications aren't being taken correctly. Staying with the client overnight, either to provide services through the night or to be available in case there is an emergency. Trinity In-Home Care provides services on a private pay basis, including a sliding scale which is supported by donations and community support. But also, Trinity In-Home Care is a contracted provider with the following programs. Medicaid's home and community-based services as an agency-directed provider for 3 waivers: intellectual developmental disability, physical disability, and frail and elderly. Again, Trinity In-Home Care's private donors help make it possible for Trinity to offer these programs. The Veterans Administration's Home and Community-Based Services Program, Older Americans Act and Senior Care Act through the Jayhawk Area Agency on Aging. Many long-term care insurance policies will cover in-home support services. Please review your policy and call the office if you would like to investigate your policy's coverage. And Trinity In-Home Care works with a few more programs. Please call our office to ask if your program is included in our services. Unfortunately, Medicare does not pay for non-medical services. How do you get started with Trinity In-Home Care? It's simple. Please call our office to schedule a no-obligation home visit. At this home visit, our social worker will discuss your needs and preferences, answer all of your questions, and have you complete some basic paperwork. Trinity In-Home Care does not have a contract. You can increase or decrease your services, or even cancel services at any time. Once this home visit is completed, you will be entered into our scheduling system. The administrative staff at Trinity In-Home Care will work hard to quickly find a direct support professional who fits your needs, is available at the times and the days that you need, and with whom we hope you will build a trusting relationship. What are some things that you should know to have a successful in-home support experience? Because Trinity In-Home Care works to be efficient and keep our administrative overhead low, communication is a critical element in these efficiencies. Sometimes there is a miscommunication, and in those instances, we value the feedback and information from both our clients and our direct support professionals to clear up any misunderstandings. Trinity In-Home Care's direct support professionals often work with multiple people through the course of their week. They are able to create a schedule that is flexible. If you have flexibility in the times and days when you need assistance, be sure to share that with Trinity In-Home Care. That can decrease the time that you are waiting for a direct support professional to be assigned. One way Trinity In-Home Care is able to keep our services so affordable is that our direct support professionals do not bring cleaning supplies with them. This allows you to choose the supplies that you prefer and that you find most cost-effective. If you need, your direct support professional can assist you in purchasing supplies when you run out. Additionally, Trinity In-Home Care's direct support professionals are not trained housekeepers, as we are not a housekeeping company. But with your direction, your direct support professional can assist you with the light housekeeping tasks that keep your home clean and safe. If you need heavy-duty or intensive housekeeping, Trinity In-Home Care can refer you to a housekeeping company. Some people are able to have a professional housekeeping company visit them a few times, and then our direct support professionals are able to maintain the home from there. Please call our office if you have questions about your home's care. Similarly, Trinity In-Home Care's caregivers are not authorized to do heavy yard work. If your home's yard requires maintenance and you aren't sure if the tasks would be appropriate for a direct support professional, please call the office and we'll discuss. Please provide your direct support professional with instructions of how you prefer to have tasks around your home completed. Because everyone likes things done a little differently, each direct support professional expects some degree of on-the-job training specific to each unique individual that they work with. What are some other things you should expect during your direct support professional's visit as a client of Trinity In-Home Care? Your direct support professional is instructed to clock in immediately when they arrive and immediately before leaving. They are required to use your phone to do this, as our clock in and out system can track where an employee is when clocking in and out. Please be sure to provide your working phone to your direct support professional when they arrive, and please don't make any requests of your direct support professional after they have clocked out from their shift. If this phone system doesn't work for any reason, your direct support professional is instructed to complete an error report with you. This simple form confirms their arrival and departure time and includes your signature. Your direct support professional will turn this form into our office after their shift with you. If your direct support professional is sick or unable to keep their scheduled visit with you, they are asked to contact you immediately. If it is appropriate, they are allowed to reschedule that visit with you at a time which works for you both. But if you cannot reschedule, your direct support professional will then call the Trinity In-Home Care office to request a fill-in, meaning another direct support professional will come to complete your needed tasks. Unfortunately, Trinity In-Home Care cannot guarantee the availability of another direct support professional, especially on short notice. But you can be confident that Trinity In-Home Care's administrative staff will do all within their ability to find another caregiver to meet your needs. If you are a private pay client, or if you have a client obligation or a gas reimbursement bill, you will receive your invoice monthly. Please pay promptly. We offer a number of different payment options to meet your needs, including credit card autopay and checking account autopay. If you ever have a question or concern about your invoice, please call the office right away so we can review it with you. Also, please do not pay your direct support professional directly or offer your caregiver cash or gifts. If your direct support professional goes shopping on your behalf, they are expected to provide you with a receipt and change if appropriate. Trinity In-Home Care is proud of the work that we do throughout Douglas County. We are proud of our team of direct support professionals, and we love what we do. We are honored that so many people throughout Douglas County have trusted us for well over 40 years to come into their homes and help them enjoy their best quality of life. We look forward to working with you.